name is Esme Bakker and I'm a dual PhD student of the Radboud University Medical Center in the Netherlands and the Liverpool John Moores University in the UK. Together with my co-authors, we wrote the paper Association of Resistance Exercise with the Incidence of Hypercholesterolemia in Men. This paper will appear in the April 2018 issue of Mayo Clinic Proceedings. The take-home message from our paper was that less than 1 hour per week resistance exercise significantly reduced the risk of developing hypercholesterolemia in men compared to no resistance exercise. This association was independent of aerobic exercise. Regular physical activity is recommended for the prevention and treatment of hypercholesterolemia. The positive effects of aerobic exercise on serum cholesterol levels are well documented. However, the effects of resistance exercise from large prospective cohort studies are very limited. Therefore, the aim of our study was to investigate the association of resistance exercise independent of and combined with aerobic exercise with the development of hypercholesterolemia in men. We hypothesized that resistance exercise lowers the risk of hypercholesterolemia and that participating in both aerobic and resistance exercise is superior in decreasing the risk of hypercholesterolemia when compared to each individual type of exercise alone. This study used data from the Aerobic Center longitudinal study, which is a large cohort examining the effects of clinical and lifestyle factors in the development of chronic diseases and mortality. Frequency and the total amount of resistance and aerobic exercise was measured using questionnaires. Blood was drawn to determine cholesterol levels at baseline and during follow-up measures. After a median follow-up of 4 years, 20% of the men developed hypercholesterolemia. Meeting the resistance exercise guidelines lowered the risk of hypercholesterolemia with 10%, after adjusting for potential confounders and aerobic exercise. Meeting both aerobic and resistance exercise guidelines lowered the risk of hypercholesterolemia with 21%, compared to meeting neither guidelines. We also looked at the total amount of resistance exercise, and we found that less than 1 hour per week resistance exercise lowered the risk of hypercholesterolemia with 32%. Also, 2 sessions per week of resistance exercise lowered the risk of hypercholesterolemia with 31%, compared to no resistance exercise. We also examined the dose-response relationship of resistance exercise with the risk of hypercholesterolemia in our figure 3 of our paper. In this figure you can see that the lowest risk of hypercholesterolemia was at 58 minutes per week of resistance exercise, and that higher levels of resistance exercise did not provide further benefits. So in conclusion, our results suggest that compared to no resistance exercise, less than 1 hour per week resistance exercise was significantly associated with reduced risk of hypercholesterolemia. This association was independent of aerobic exercise. This total amount of resistance exercise could be easily accomplished by most adults. In addition, meeting both recommended guidelines for aerobic and resistance exercise provided the highest additional benefit in the prevention of hypercholesterolemia. Therefore, our results suggest that resistance exercise combined with aerobic exercise could be encouraged in order to reduce the risk of developing hypercholesterolemia. These findings support the current physical activity guidelines and could have a profound impact on population and public health perspectives. However, since we were not able to adjust for diet and medication, more rigorous analyses are needed to produce more reliable and unbiased results by adjusting for diet and medication. Thank you for your attention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.